Evening, everyone. Today I will present about NeuroDetect. Okay. It proposes AI-assisted platform for early detection of Alzheimer's disease. Alzheimer's disease is leading cause of dementia and affect over 55 million people worldwide. One major challenge is that brain changes between 10 to 20 years before symptom appears, making early diagnosis difficult. Current diagnostic methods such as PET scan and cerebrospinal fluid analysis are accurate but expensive and invasive. Therefore, a more accessible and less invasive screening method is needed. Recent studies have shown that Alzheimer's disease can be detected using blood biomarkers, and the most promising biomarker is plasma p-tau 217. I'm sorry. Okay, why are the important biomarker includes A beta 42/40 ratio GFAP, and neurofilament light chain. A 2024 study published in JAMA Neurology shows that p-tau 217 has high diagnostic accuracy and closely matches PET imaging result. In addition, the 2024 Alzheimer's Association guideline now recognizes. Okay, guys, I'm so sorry. I'm having a nervous laugh. Okay, association guidelines are now recognizes. Validation blood biomarker as part of Alzheimer's diagnosis, highlighting their growing clinical importance. Based on these findings, we will propose NeuroDetect. NeuroDetect combines multiple blood biomarkers with clinical information such as age, family history, and cognitive assessment score. An AI model analyzes these data to estimate an individual risk of Alzheimer's disease. Our goal is to develop a screening approach. This is accurate, minimally invasive, and more accessible than current diagnostic method. First, blood sample and clinical information are collected from healthy individual patients with mild cognitive impairment and Alzheimer's patient. The blood is analyzed for Alzheimer-related biomarkers. These results, together with clinical data, are entered into an AI model. The model predicts an individual Alzheimer's risk, and its performance is validated by comparing the result with PET imaging and cerebrospinal fluid analysis. There are still several challenges. Biomarker level can vary between individual. Okay, AI model require large and diverse data set, and further clinical validation is needed before routine use. Despite this limitation, NeuroDetect could support early screening, assisted clinical decision-making, improve patient selection for clinical trial, and contribute to more personalized Alzheimer's care. In conclusion, recent advances in blood biomarker have created new opportunity for early Alzheimer's diagnosis. Supported by the latest research, NeuroDetect combined with multiple biomarkers with artificial intelligence to provide a promising, minimally invasive screening approach with further validation and development. This platform could improve early detection, enable earlier treatment, and help make Alzheimer's screening more accessible. And thank you for your attention.
Thank you for your presentation. Okay. If there is the patient who is 50 years old male and his MMSE or MOCA test are normal yet, but the blood test there is a high risk of Alzheimer's disease, and then what will you suggest?
A normal MRI does not rule out early Alzheimer's disease. If the blood test shows a high risk, the patient should undergo further confirmatory tests such as like PET scan or CSF analysis and receive regular follow-up. NeuroDetect is just used for screening, not for making the final diagnosis. So further testing may be required.